Prynhawn dda a croeso. Good afternoon and welcome to Public Health Network Cymru's webinar this afternoon on Universal Basic Income. My name is Kieran Humphreys. I'm a consultant in public health with Public Health Wales with the wider determinants of health unit that hosts Public Health Network Cymru. I'm really thrilled to be here this afternoon to have a session on universal basic income. We all know that having a basic income is essential for health. So since the financial crisis in 2008, the subsequent austerity and now COVID, there's been massively increased interest in this as a policy to improve health. And so this webinar is really timely given Welsh Government's interest in running a pilot here in Wales. And I'm delighted to have two experts here to talk to us about the policy matter in hand. The first is Adam Jones, he's a senior policy officer with the WHO Collaboration Centre on Investment for Health and Wellbeing in Public Health Wales. This is not Adam's first visit to us in the webinar, so welcome back, Adam. He's been with Public Health Wales as a public health practitioner in policy since 2015, but before that he's worked as a Public Health Wales sexual health network coordinator and comes with a background of a BA in politics from the University of Wales Institute of Cardiff and an MSc in economics, politics and public policy from Cardiff University. He'll be talking to us about the work he's done to explore who has looked at using universal basic income, what's been found and how this could improve health. Also today, delighted to have Jacob Ellis, who's a changemaker lead from Public Affairs and International Office of the Future Generations Commissioner for Wales. His main responsibilities are advising senior stakeholders and government ministers to implement the Wellbeing of Future Generations Act. And in 2019, Jacob established the Future Generations Leadership Academy, and he's worked internationally to promote the world-leading legislation of future generations. He's a non-executive director of Literature Wales, trustee of Scaes Cymru and Theatr Genedlaeth Cymru. I'm really delighted to have him here today to talk about the Commissioner's reflections in favour of universal basic income and how a pilot in Wales, if designed well, can have multiple benefits, and also to consider the what next for us here in Wales. So before we hear our talks this morning, just a few housekeeping points. There is an option to give some questions and answers. If you have a look at the little question mark bubble on your screen, you can give questions any time to our speakers, and we'll put them to our speakers at the end. If you have technical issues, you can also put them in the box as well, and don't worry, we won't publish them to the world. We'll try and address your issue directly with you with our technical support in the background. The webinar is being recorded and will be made available on Public Health Network Cymru's website after the session. And finally, English and Welsh subtitles are available. There's just a 3-dot button there. If you click on that, you should find the option for captions. So moving straight on in, I'll ask Adam to pick up the reins and talk to us about his work looking at universal basic income. Adam, thank you.
Thank you, Kieran. I'll just get the slides up now, show you all. This all works perfectly in rehearsal, so let's hope it works perfectly in reality as well. Here we go. And hopefully you can all see that now because I can't see you. Someone shout out if you can't. So thank you all for attending today. I'm going to be presenting on the key findings from the recently published report on basic income health in Wales that we released back in June, I think it was, towards the end of June. And as Kieran says, I'm Senior Policy Officer in the WHO Collaborating Centre here at Public Health Wales. And that's how you can find me and contact me. That's also at the end as well, so don't feel you need to rush to scribble it down if you want me. So in this presentation, I'll be talking, as I say, about the report, so a background and an overview of the report, some of the key lessons regarding health and well-being that have been identified in that report, also some of the key lessons regarding pilot and scheme designs from implementation around the world and what that could mean for policy and practice in any country, not just in Wales. and some conclusions and key questions to consider. So I've had a long-standing interest in basic income, going back, back to my undergraduate days, actually, back in 2007-8. One of my ideas for an undergraduate dissertation when I was doing that politics degree that Kira mentioned, in the end I did something entirely different, which I won't bore you with today. But I kept that interest for a very long time and spoke about it in work in one of our internal lunch and learn sessions in 2016. And got a lot of interest, people seeing it as a novel thing to talk about in a public health context. And then that evolved into preparing this piece of work, which of course we developed and started working on, not anticipating there'd be any kind of real policy movements in the near future. And it was fortuitous that we published the report just after the First Minister's announcement back in May. So it's become very timely indeed, this piece of work. So that's what it looks like, the report. The link there, it's probably again easier just to Google it than scribble that link down quickly. The links will be provided after the session though. So what do we do in this report? It's a report that's aimed at decision makers who are considering a basic income in Wales or anywhere, frankly, in the world. Oops, that's just disappeared for me. Has it disappeared for you? I'm sorry, PowerPoint just crashed, so just bear with me.
I didn't quite catch that.
And Siri was triggered then as well. I don't know what's going on here.
Hi Adam, yeah, the PowerPoint has crashed. Can you manage to pull it up again by any chance?
I'm just waiting for PowerPoint to open again, Casper.
Okay.
I'm not blessed with a very fast computer at this end. It's up now.
Would you like me to share the PowerPoint, Adam?
It's there.
Okay.
There's always something, isn't there, when we do these? Let me just skip back to where I was. There we go.
Yep, you're back on the red screen, Adam.
Perfect. Okay. So the report's aimed at decision makers, as I say, in Wales primarily, but of course I think there's lessons for anyone anywhere in the world really in this report if they're looking at doing a basic income with health as one of its cornerstones, health improvement. So we introduced the concept of basic income, appraise the existing evidence that's out there, and explore what the next steps could be for Wales or anywhere, as I say, to develop a rounded basic income proposal with health improvement as a key ambition. And it's important to stress that we don't advocate for or against basic income. We try and provide a balanced, impartial look at the existing evidence base and the range of the debate as well around basic income. And in summary, that's the contents of the report. So the introduction about basic income, it's looking at the different definitions that people use of what is basic income, different approaches, and also reflection on some of the alternative universal things that are out there, like universal public services is one example, political and public perspectives, some criticisms as well, and look at the pilots and pilot designs that have been introduced around the world and the different nuances with all of those. We look at the evidence of observed or uncertain health and wellbeing changes as well from those pilots or fully implemented schemes, and then look at some areas that policymakers and proponents should consider if they're making a proposal for a basic income scheme anywhere. And then looking at overall conclusions and key considerations as conclusions. So we launched it on the 22nd of June, as we say. A lot of coverage on social media. I did a little short video overview. I mean, it was a task to summarise in 1 minute what has been years worth of looking into something, and it's such a complex thing as well to talk about in a minute. I also was interviewed by Global Radio for Heart in Wales and some of the other stations that went out. It was covered in the Big Issue a couple of weeks afterwards as well, and in some of the regional press. And I've put some of these tweets up that were talked about. There's the Public Health Wales one I talked about where we did the video. Some reflections. I've never had my phone go as crazy as when this report was published, with really positive messages supporting the publication of the report. But these two tweets that were responses to the Public Health Wales one, I thought are really interesting to highlight in this discussion. You know, because these two tweets reflect the diversity of opinion on basic income as a concept. So the first one, wouldn't it be better to put more effort into jobs rather than paying lazy people to stay in the house? That's one perspective. And the second one, this could give me the freedom to reduce my hours, meaning I could do more for my elderly parents, which in turn can reduce pressure on our care sector. It could actually lead to savings for the government. So you see there's real diversity on this topic, and that's why getting things as right as possible at the outset is really crucial. So what were some of the lessons for health and well-being? So the findings include an 8.5% decrease in hospital admissions that were observed among recipients of basic income in Dauphin in Manitoba in Canada, and that's a scheme in the 1970s. And those decreases were particularly noted in relation to accidents, injuries and mental health conditions. In the recent Ontario scheme, less frequent visits to health services have been noted. Over 80% of respondents to surveys about that Ontario scheme reported improved health. An earlier survey saw 45% reporting fewer health problems, 88% reporting less stress and anxiety, and 73% reporting reduced depression. So those are findings over 2 years worth of surveys. The first part is the first year and the second part is the second year. Sorry, the other way around. The first part is the second year's survey. The first part of that bullet is the first year's. In Finland, another recent scheme that you've probably heard of as well, better mental health outcomes were noted amongst their recipients, lower levels of loneliness and depression, and overall life satisfaction was improved in the opinions of those recipients. And in Ontario, reduced medication use also noted. They have a private medical system, of course, so in the context of that, 83% found paying for medication easier, and 74% reported the same for paying for dental care. But it's important to caveat all of this, that whilst we've got these relevant findings, and there's many more in the report, by the way, this is just a real snapshot of the report's findings, we must exercise some caution with interpreting the findings because they've been based on limited pilots, limited trials, and in some cases limited response rates as well. So we have to be careful on putting too much onto the evidence, but it's all positive in this respect at least. And from a wider determinants of health perspective, and I'm conscious as possibly people on the call who are not so familiar with that concept, people who are joining us just for the basic income hat on. When we talk about wider determinants of health, we talk about the things that impact upon our health from other policy domains. So it could be transport methods, it could be education provision, or the housing that we live in. These are the wider determinants of health. And there's been a limited but positive impacts noted on different policy domains. And again, the report goes into each one in more detail in different areas of policy. So increasing income security is one aspect, reductions in child poverty and improvements in other childhood outcomes, increased social inclusion, improved educational attainment, equity improvements, particularly amongst the disabled populations and women as well, greater food security and improved nutrition, housing quality improvements as well, and more affordable housing options. And we'll see some of the qualitative stuff next as well, which talks about some of these aspects. Some of the quantitative findings, these are quotes that are pulled out of the report from other reports. So if we look at North Carolina's scheme, they saw a $4,000 increase in household income reduced the poorest kids' chances of committing a minor crime by 22%. That's one of the longest running schemes. It's a pretty unique design, that one, but the evidence base is over 20 years old there, so it's quite robust data. 79% of Ontario's basic income recipients were somewhat or much more motivated to find a better paying job whilst receiving basic income. Some of the criticisms of basic income is that it will make people work shy, stay at home, quit their jobs and just do anything, frankly. But that doesn't really, it's not really borne out in the evidence. There's very minimal labour market effects, and in many cases, in many examples, it's actually improved labour market effects as well. In Ontario, 28% of survey respondents stopped using food banks, 55% purchased food that they couldn't usually afford, 74% were able to make healthier food choices. And again, just to caveat that with a relatively small response rate in that survey. Barcelona's, the Beam Income Scheme, as it's called there, it was called there, effective in reducing the probability of developing mental illness, they found. A reduction of 9.6 points is observed, percentage points, although a greater effect is detected in the conditional and unlimited groups, because they were comparing different groups of different amounts of receipt or non-receipt of basic income payments. So what you're probably picking up when I'm talking here is very different approaches to implementing and trialling basic income. So we have to also balance the evidence we've got with the design of the scheme we're talking about as well. Some of the qualitative stuff, this is the stuff that I always find most fascinating, I have to say, that what is people's actual lived experience? What are they telling the interviewers and the researchers? So Ontario, there's some examples. I was able to do some necessary home repairs. I was beginning to lose weight slowly because I could actually afford better options. I was able to try out a few different jobs, try new things, see what fits me, what doesn't, without having to worry about where my food was going to be coming from. I was able to search for a good apprenticeship without settling for something less professional. Some of the ones from Barcelona there, I'm in a better position to look for work. I can pay to print my CV, you know, simple things like that. We don't probably appreciate in our context, but paying to print for the CV was something that person felt worthy of reporting on. Or to take public transport. I could do any of that before. I couldn't do any of that before. And with Beam Income, I can pay for the school now. We can buy food, we can buy clothes, things for the children. Everything is a little bit better now. So there's some really interesting and strong findings from all of these trials and experiments. So what are some of the key considerations that I think health practitioners need to think about when talking about basic income or begin to think about basic income? Well, I think those that are working to improve population health and well-being should familiarise themselves with the key arguments about basic income and consider the potential health impacts from any proposals. And to make a proposal for basic income robust, proponents, whether that's in health or anywhere, frankly, must consider what basic income can do to improve health and well-being in light of the current health status and public policy context of wherever they're sat. So what could basic income do for you in your context? So some of the lessons regarding pilot and scheme designs, because it's important, although I'm a public health practitioner, so obviously primarily I'm bothered about health improvement, I'm also a senior policy officer, so I'm there to recognise that policy design determines health outcomes. So this is why this one half of the report is looking at the policy design in itself. So there's some contention in the literature about whether basic income schemes must be universal, and you'll note that I never say universal basic income, I just say basic income, just for ease of reference. And that would mean payment to all without means testing, and unconditional, for instance, paid without a requirement to work. There's debate over how basic income should be provided, for instance, whether it should be entirely replacing existing welfare in any country's context, or whether it should complement existing welfare benefits. And again, there's a real mixture in the pilots that have been observed worldwide. And I think the really important point to note in all of this discussion and all of the consideration of evidence is that there are no two examples of basic income implementation worldwide that are the same. All of them have something slightly different to another. And none of them in a developed world context, so the Canadas, the Finlands, the Americas, anywhere else in the Western world really, none follow that ideal definition that I'm going to present over leaf. And this is, I think, understandable. I don't think anywhere in the world there are any social policies that are exactly the same. We might all have an ideal for what a policy should look like. We might have an ideal for what public transport should look like. But it's no two countries really do anything the same, and we've seen that with the COVID response, haven't we, in recent times? But there is an ideal definition out there for what basic income should be. And this is what I've termed the classic definition, and it's provided by the Basic Income Earth Network, which is the main global advocacy group. They define it as a periodic cash payment unconditionally delivered to all on an individual basis without means test or work requirement. So let's take a look at that section by section. So periodic, it would be paid at regular intervals, for example, every month, not just a one-off grant of X amount thousands. A cash payment, so it's paid in cash, so it's not things like food vouchers or food stamps. It's individual, so it's paid to each individual in the house, not to the house. So I live here with my partner. In theory, we'd both get the same payment rather than me just get the payment on behalf of the household. It's universal, paid to all without any means testing. And again, some people think all should include children as well from birth. Some people would argue universal begins at adulthood. Again, different things in the literature. And unconditional, it's paid without a requirement to work or to demonstrate willingness to work. As I say, all trials and schemes have had their own unique contextual approach to introducing a basic income that fits their situation. And I put examples of this in the report. There's some what are called guaranteed annual income schemes, of which Alaska's would be an example there. And that's a pretty unique case because it takes 25% of revenue from the oil industry and distributes it to people who live within Alaska in the year prior to that year's claim. And there's some examples there. Another unique example, North Carolina. This was because of a development of a casino in North Carolina, which was against the Cherokee community tribe members' beliefs and cultural beliefs. As compensation, some of the proceeds for that casino goes back to the community, and it's split 50% to individuals and 50% goes into a community pot, and the community decides how to spend that. So they've done things like a water treatment plant, for example, was developed in North Carolina's schemes. So you see the very unique schemes out there as well, alongside those classical approaches that would follow the definition. So what should policymakers consider, really? And again, this is anywhere in the world. I think it's not unique to Wales, this. So starting off with financial modelling, feasibility studies, possibly, impact assessments to be developed and delivered as part of developing that proposal. And if it's to be piloted, there must be a commitment for the pilot to be of sufficient duration to generate some evidence of impact. I'm not going to define what sufficient is, that would be different in different contexts. The pilot should be delivered by a range of stakeholders as well, because, as we say, this is not just an incomes policy. This could impact on various aspects of our public lives, whether we access education, how we use transport, whether we spend more time in the natural environment. So there's got to be a range of stakeholders involved. So some of the conclusions now. And of course, we know since the report, well, just before the report was published, that the proposal we put forth for care leavers pilot here in Wales. So I looked specifically about care leavers and evidence related to that. So there is no direct evidence, there's no other scheme in the world that was focused on care leavers, but I can't categorically say there weren't care leavers as part of schemes that have been introduced worldwide. But there is an emerging scheme in Santa Clara in California, which is looking at care leavers, and I'll talk about that on the next slide. But we know that the care leaver cohort in Wales is one of our most vulnerable populations, and these are some of the reasons why there. So we've got high numbers who are not in education, employment or training 12 months after they leave care, and it stays quite high after 24 months of leaving care. We know that some from the stats there have ended up in unsuitable accommodation after leaving care. We know a lot of people are in care in the first place because of adverse childhood experiences, and they tend to have worse educational and employment attainment than their peers in the non-care community. So this is part of the thinking, I suspect, of why care leavers are being considered for a pilot in Wales. A group in Scotland, Aberlaw, this is a children's charity in Scotland, put this in their manifesto for last year's Scottish parliamentary elections, calling for a guaranteed income for care leavers. So similar to what we talk about here. Again, just thought worth reflecting that other parts of the UK have also thought about this. So this Santa Clara one that I talk about, it launched last year, offering $1,000 to 24-year-olds who are no longer eligible for foster assistance. It's funded to assist 72 former foster youth in this trial and the evaluation costs as well. They also offer credit, with the support of a credit union, some financial mentorships to get the young people off to a good start in life and understanding finances and tax returns, which is such a big part of the American experience. And it was recently, actually just in July, extended across, well, the bill was approved to extend it across California as a whole. And there's some really interesting reading there about this scheme for foster youth leavers in California. So to conclude then, what do I think are the key considerations for basic income policies anywhere? So for the proposal, what is basic income in your context? Who's it for? What do you know about this cohort already, and where, as in geography or locations? What do you want basic income to achieve? So to have clear aims and objectives at the outset. What do you want to measure? We could measure everything. We could essentially do the National Survey of Wales for the whole recipients and measure every aspect of daily life. But is that feasible in the short time? Is it feasible with research costs? Which organisations should be engaged in delivering it? So that, you know, down to the nuts and bolts, who would actually make the payments to people? How will it be funded? So is it mainly in public finance, or is it things like the Alaskan example, where it's from a proceeds from a development? How much will be offered as that basic income? Well, that's crucial, isn't it? What is the actual payment amount, and how will it be administered? And would it be conditional? Some people might think it should be. How long will a trial last? So, you know, it needs to be sufficient to monitor and evaluate, to measure change, and will it overlap the government's term of office? Now, that's an important point, because Ontario's did, and that's why it was suddenly ended within, I think it was 18 months after it had started. So it started just before an election, change of government, and the trial was suddenly withdrawn, causing the people on it to have some difficulties, because they obviously planned for 3 years worth of payments. And then for implementation, this is the final slide, by the way. How will recipients find out about basic income? So that you need to have that engagement at the start to get people on board. Who will have day-to-day responsibility for administering the scheme? How will outcomes be monitored? Who will oversee the implementation? How is basic income interacting with other policy developments? And again, in our context in Wales, it's particularly important to consider non-devolved areas of policy, which will be, you know, quite influential on this as well. And how will the trial end? We're talking a lot about how we start things, but how do we end it, and how do we ensure people don't have a cliff edge right at the end of that pilot scheme? Because we can't assume that the pilot will continue indefinitely. You know, we have to plan for an end and make sure everyone involved, whether it's administrators, the recipients, know about that end date. So that's some of my thoughts, really. The report will go into it in a lot more detail, and you can't escape me. There's all the details if you want to contact me outside of this window. And I'll pass on now to Jacob, if he's ready. I'll just stop sharing.
Thanks.
Sorry, Jacob. Sorry, I said Jacob, didn't I? Sorry.
All right, I've got many things over the years, Yakult amongst them, so I can live with Jacob today. Many thanks, Adam, and thanks to Public Health Wales for inviting the Office of the Future Generations Commissioner to follow on to contribute to today's webinar. Very usefully, Adam has presented many of the arguments that I was going to cover, so we're on the same page, which is good. And what I will try and do is explain how all this fits into the Wellbeing of Future Generations Act, and how it is that we can take this forward in terms of the ambition and the approach that Welsh Government are going to take. And I'm hoping that there are Welsh Government colleagues on the call, and others that may be called upon to influence and co-develop this policy, this exciting progressive policy that government have announced. Started off with this quote. Now, there are several hundred quotes out there that I could have chosen. I've chosen this one from Scott Santons, and if you haven't followed him on Twitter, an American, I believe, a big UBI advocate, and regularly tweets and shares information about UBI, and touches on actually some of the research that Adam has also found to support his work. So as long as people can only focus on the end of the month, they can't focus on the end of the world. It's too big, it's too far away. We have to free people from short-term surviving so we all can finally focus on long-term thriving. Now, this was tweeted yesterday or the day before when the IPCC published their climate change report. And a question, not something that we can't go into much detail in terms of the 8 minutes or so that I have, but will a UBI contribute towards tackling some of our long-term challenges, if we can call them that these days, around climate change in particular? Is it one of the levers, one of the mechanisms that we can start with that might then enable us to address some of these longer-term challenges as well? A debate possibly for another time. So our journey in the office around basic income can possibly be started around this time last year, really, and possibly just before that, when we published our Future Generations report. The Commissioner came out in support of a universal basic income pilot for creatives. Obviously, a cohort, that had a community that had been struggling throughout the pandemic. There are others, of course, that fall into this space. And it is then, in terms of some of the conversations we were having, really drawing on the excellent work that the grassroots movement of the UBI Lab Wales and others across Wales were doing, speaking to think tanks and conducting some early research. Starting to understand then this was something much more exciting, that was possibly something we wanted to take more nationally rather than just focusing on one cohort. We had conducted or commissioned a research, 69% of people in Wales supporting a pilot of the universal basic income. Very recently we've written to the First Minister alongside other advocates, suggesting that their approach is admirable, but there are other further and wider considerations that need to be considered around extending the cohort size and its membership, rather than simply looking at or solely looking at one cohort. And then we've seen, haven't we, in terms of that 69%, but again in other circles politically, we've seen councils support as well, and backing universal basic income, RCT there, and there are many others across Wales, a growing appetite in this space, with 25, as I understand, members of the Senedd who are now there, I should say, supportive of a UBI pilot, and many more candidates did in the last election. Which has led us possibly to the petition there that you can see on the left, and I'd encourage those who are advocates of UBI and would like government to consider that broader aspect, which I'll go into late in a moment, to head over to the petition and sign it there. So it's still a very, we're all learning, aren't we, with this new policy area. But what do we face in Wales? And we've had some of the statistics there from Adam about what it is that we're facing here in Wales. Highest level of children, working age adults and pensioners living in poverty in the UK. Wales, amongst the highest there. We've seen, and we touched on the determinants of health there, the World Health Organization setting out that income security and social protection is the largest contribution to health inequality. So what's Wales's response to that, and how do we ensure that any policy that we're building takes into account these statistics and things like that? So the other thing is the welfare state, as we know it, probably isn't fit for purpose anymore. People not claiming universal credit last year, the queuing, the form filling, the stigma that's attached to some of the processes here, making it really difficult for those that need the money to receive it. And then future trends. I mentioned the climate crisis there, but there are many others that are facing us here in Wales, not unique to Wales, but what's Wales's response. And the workforce is changing. The competition for jobs will be there, and how do we respond to this care crisis over the last 18 months being highlighted as a serious issue? And then there's potential double whammy threat to some occupations from COVID, redundancies and automation. Only today in the BBC, isn't it, that COVID has accelerated some of that automation, a serious threat then to jobs in accommodation, food services and retail and so on. Focusing then specifically on skills, you know, the last 18 months has seen a significant change as a result of the pandemic in terms of the economy. Current skills and employability programs we've seen are not future focused, and we've published some work on that, where Welsh Government need to focus its energy in terms of its green recovery. And then the further education levels have fallen by 43%. So how do we you know, look at lifelong learning and look at that challenge and the skills gap there? And just one statistic, I know this slide could have been longer and many other presentations to be added to it, but the use of zero-hour contracts rose by 35% between 2018 and 2019, leaving Welsh people without a stable income. So what is it that we can do to address these and some of the points on this slide and others when we're approaching this policy question around a UBI or a basic income pilot here in Wales? So what can we explore? And I think the first thing to point out is that we would expect any pilot of any kind, of any policy description, to take into account the 7 wellbeing goals. So we're seeking to contribute, to maximise our contribution towards 7 of those goals. Not one of them, not a couple of them, but you know, there's a real opportunity here to design a policy and a pilot that would seek to contribute to all of those goals. How can we do that from the outset? Government colleagues on the screen will be well familiar with these wellbeing objectives recently published in the programme for government. And although piloting a basic income appears, I think it's in the 9th objective there around making our cities, towns and villages even better places in which to live and work. I believe that's where it sits. A basic income pilot, one would argue, could have multiple benefits across all of those wellbeing objectives, and should. You know, there's the 5 ways of working in the Act, integration being one of them, and where we would be encouraging Welsh Government and other public bodies in this space to integrate their decisions and policy actions across the full suite of steps and wellbeing objectives. So there's an opportunity here, you know, to encourage that more holistic and broader perspective in designing this policy, not only to meet that 9th objective, but is there something that can be done to, from the outset, in the early conversations, to start working across all the other 9 as well, and then within the steps themselves. So not seeking to do this from one part of government, but something that's much more broader and collaborative. So some of the arguments, the themes to explore in a pilot have been covered by Adam eloquently. Some I'll be repeating, but I'll try not to pause on them too long. But I noticed there was a question, and we may come on to it in more detail later, but around one of the other benefits other than poverty when it comes to giving children a basic income. And Adam's right, you know, there are conversations about from 0 to 18, keeping that money, giving it to a parent or a guardian in the interim. There's all kinds of considerations around funding for children. But this one, you know, an example of school attainment and performance from Namibia in 2007 or 2009, where the attendance in the schools almost doubled. It grew by 90%, and the reasoning because more parents were able to sustain the cost of sending their children to school, and dropout rates fell from 40% in 2007 to 5% in 2009. Now there are other examples, I have no doubt of that, and I'm not going to dwell too long on each of these areas. The ability to age well, another area that or a theme that we would encourage any pilot in Wales to explore. The basic income gives people the opportunity to care for their elderly loved ones. This ensures the elderly can spend their final days in the care of family and friends. Many people have to weigh up the choice of caring for a loved one or giving up work, and this difficult choice may be removed then for many with a basic income. We believe that intergenerational initiatives will thrive, bringing generations and communities together. Volunteering is something that's been very clearly shown in research as an opportunity to enhance that and promote that more. And of course, the less pressures on the health service and addressing issues like loneliness and isolation when it comes to ability to age well. There will be other reasons and other factors. Health and well-being, Adam has referred to some of these, so I'll skip the first example there, but talk about mental health, and talked earlier about the system not working and the stress that causes, and the stigmatization, if I can get the words out, around that, and that hopefully a basic income will help to improve mental health, and we've seen examples of that. And then interestingly, this last one here, out of 44 estimates of drug and alcohol spending across 19 studies and 13 interventions of cash transfer programs, 82% of these studies showed a decrease in spending on drug and alcohol. And I think there's just so many myths out there, misconceptions. One of them, people will stay at home and not work. Well, albeit there are, more research needs to be done. Adam has demonstrated and already alluded to this. There are examples where that has been an incentive, particularly in the Finnish example. So whatever is through this pilot, I think communication is going to be so important. This one's important because of the context around care leavers and the narrative around that, and the focus and the ambition from governments on this. So this has come from the United Nations Research Institute for Social Development, published this year, a report. The more universal a programme becomes in terms of coverage, rules of access and membership, and adequacy of benefits, the greater the potential for redistribution, risk pooling, cross-subsidisation, efficiency gains and quality control. The ideal type of a universal social protection programme is a basic income grant for all citizens or residents, financed out of general revenues provided on an unconditional basis. So I think this pilot that we're about to enter in Wales, or discussing in Wales, must seek to best ability to addressing this issue around universality, and the wider the pool, the wider the sample, the better outcomes and the better data that we'll have in order to then fully roll that, hopefully one day, nationally. I'm going to skip that one because I'm conscious of time, but just reiterating some of the comments that Adam made, but potentially putting a little bit of specifics on there, if I may. Communication is key. Yes, 69% of people in Wales are supportive in one survey that we conducted, but there are still many questions to be answered. And I think with any experiment and any new progressive policy, furlough being one of them, but that's another argument and another debate for another day. But there are going to be questions, and there are going to be uncertainties, and I think that government and other stakeholders have an opportunity here to tackle some of those myths and talk openly about the positives and indeed the challenges that the basic income could pose. We believe that it shouldn't be solely targeted at a particular subgroup of the population. I think there's plenty of research out there that suggests why. We believe it should be around 5,000 participants, but we can grow the numbers up or down. The period is really important, as Adam suggested. We think that should be around two years. Any longer than that, I think there's some fatigueness in the system, and then you get into the political problems that Adam suggested around end of term, things like that. But then there would need to be a period for evaluation as well, and I think that's such an important part. And any support that's needed to the cohort and to the samples, to the people who are involved. And there's throughout, I should have mentioned this, that we would expect that anybody involved in the cohort should also be, involved in the co-designing. That we are working in partnership and involving those affected. Non-means tested and non-withdrawable monthly payment. That's a very clear rule from our perspective when it comes to pilots like this. There are no conditions that we would expect to be set here. And of course, monitoring and evaluation of it. So a very speedy, longer than 8 minutes or so, but I hope that was useful. I'll hand it back to you.
Thank you. Thank you very much, Adam and Jacob, for those really fascinating talks and the very comprehensive coverage of the whole range of issues, both learning from elsewhere and thinking to the future for us in Wales as well. We've had a number of questions, and the first one is actually perhaps a somewhat skeptical view of our ability to implement something of this nature in Wales. So it says, the comment is, sorry, I've been part of the mess that is UC, Universal Credit, I assume, since 2012, direct payment pilot, and then right through. Like yourself, I've worked in policy forever. That was in relation to Adam's talk. The system still doesn't work adequately, considering it had taken Welsh Government years to accommodate the Renting Homes Act. Why would we think this would be a good idea? Health is one thing, but trying to mimic a complex system is another. I think this is really relevant to both of you. And Jacob, I see the screen is still on you. So do you have any reflections on that before we move to?
Well, I think that the point of UBI, if I had attempted to say anything during that short presentation, was to make the system less complex. There are so many steps and processes that those who would need to receive universal credit would need to go through, that this attempts, in terms from the payment to person perspective, limit the complexity. It is unconditional. It is going to be in your account, and how you spend it is down to the individual. So from an administrative point of view, I think you're removing some of that complexity on the civil service side, if I can put it in those terms, or having to go through multiple requests and processes of that kind. But let's not beat around the bush here and address the elephant in the room. This is new. It is going to be weird and wonderful to work through, and it is going to take time. I think that's the complexity side of things, that this is new for lots of people to have to work through, including our own government, who are seeking views and having to listen to lots of different research and stakeholders. But I do think that this is a better system than the one that we currently have. I don't think anyone would say the one that we currently have is not complex.
Yeah, thanks, Jacob. Adam, do you have anything you'd like to add to that?
I don't think I'd be as erudite as Jacob was there, but I think it's what I say when we talk about policies that don't work now, it's about looking at solutions that might work better in the future, and this is one of those, isn't it? And it's just a matter of how we go about it, what we can do in the context of devolution and the budgets that we've got to hand, and just keep trying out these new ideas that work. But this is, you're completely right, this is a complex idea with ramifications across a whole suite of policy. Like if you think about, I don't know, think about a curriculum change, for instance, that affects the education policy domain on the whole. This potentially could affect every aspect of our daily lives, and especially if it was on a universal basis, where it's every single person receiving something. So that's why the policy design has to be so crucial at the outset. So I think me and Jacob are probably talking are talking in very similar terms here, in getting it right from the outset, but also with the realism of the context that we live in, especially in a devolved setting, which other countries might not have that issue, you see, or that they've got the full suite of powers at their disposal, so it might make it a bit more straightforward in other countries. We have to just appreciate the realities that we live in and do the best we can in that system.
Can I just briefly add, Kieran? I think that with any progressive policy, the need for us to take steps in order to understand the complexities is so important, and that's why a pilot approach is a good approach. In experimenting in this way, tease out some of that complexity and the problems that then we can later look at. So wherever you are on the debate on basic income, I think we can hopefully all agree that a pilot at least takes us in some of the direction, either to confirm your views or to ease them, because that's what a pilot's meant to do.
Thank you with that.
Yeah. We've another question about that you presented finding. This was Adam during your presentation, that indicate the benefits of UBI at a population level. Do you feel that basic income would have a great enough impact to minimise health and social inequalities? Are there other policy measures that would have a greater medium and long-term impact, for example, education or better jobs?
Wow, I could spend a lot of time talking about that, couldn't I? All the different policy domains in the world. But when it comes to basic income, I think we have to be realistic. When we talk about health change, especially in a public health context, we talk about longitudinal measures. You know, we don't see things change in a year or 2 years. So we will see, you know, progress in this direction with health if we do a 2-year pilot, depending on how it's delivered and how much it is. But I couldn't stand here and say we'll see, I don't know, a 50% reduction in mental health admissions in the next 2 years. I think that'd be remiss of me to do something like that. It would also not follow the evidence. So it's an approach to health improvement. No basic income scheme actually worldwide has put health improvement front and centre of their policy design. It's been a knock-on effect that other researchers have looked at. So some of the health outcomes I mentioned there weren't the primary research objective of those trials and schemes. So that's why I think the least we can do is put health improvement ambitions at the centre of any basic income pilot, and that's a general point. And that's not just a Wales point. That's anywhere in the world, really. I hope that goes somewhere to answering that question. But I could talk about other policy domains forever.
I know it's a broad topic, and yeah, tackling.
I always say that the best thing about public health is it's everything, and the worst thing about public health is it's everything. So.
Another question is, how can we ensure this will empower individuals? That we really need to think through the approach and understand the problem defined by the target population before we come up with a solution. And I guess that's particularly going to be the case with the type of pilot that's proposed for a very specific population group. Jacob, do you have any thoughts?
Yeah, I think it's really important, isn't it? What's the outcome that we want to achieve here? And work backwards, if you like. Improve or tackle the challenges facing care leavers. Eliminating poverty in Wales. And the list goes on, doesn't it? Whatever those outcomes are, we then must have a conversation about what are the choices that we're going to take to address that. Is it a basic income, or is it a package of support that goes that's separate to that, or is it a combination of both? And I do feel a little that government have rushed in a particular way to say, okay, they we can all accept that the challenges that face care leavers are complex, and they are sensitive, and it needs to be addressed multi-level in terms of across government and other agencies. There are questions without further research and understanding and discussions as to whether or not the basic income will meet and address those challenges. As someone who's not in those worlds, it possibly might, but I think we do have to understand what it is that we're trying to achieve here, and then building up a policy or building up a pilot that's going to address that. And I think it's okay for government and others to go, even at this stage, this isn't the right approach because it might not hit the outcome that we've got. And I think that there are lots of problems in Wales that a basic income can address, and I would just hope that government look at all those before narrowing its view on one particular cohort.
Thank you. We've got we've got quite a few questions here, more than I think we're going to get through, unfortunately. So I'm trying to pick out some which come at it from slightly different angles. So if I don't ask your question, I hope you'll forgive me for that. One of the questions is the kind of universal aspect, and particularly how this will be given, maybe not the pilot in Wales, but approaches used elsewhere, maybe in future, will be given to high earners as well as low earners. And what's the impact of that? I mean, in public health, we often talk about proportionate universalism, whereas this obviously isn't a proportionate universalism approach. So what is that impact, which may be, for example, positive, apart from reducing stigma cited here, it may give well-off a chance to donate to local groups, charity or credit unions. And then, of course, there could be some opportunity costs or adverse aspects as well. So it'd be really interested in your thoughts on that. Adam.
Well, I think that the only honest answer I can give on this is we don't know, because there hasn't been a universal implementation of basic income in any context, even context where it's applied to certain communities. It's not always everyone in that community. So I think, again, I'd be speculating if I was to try and answer that question at this stage. There's a lot in the literature about what people think would be the case and what people think would happen, but I'm not comfortable enough to say what I think would happen in those contexts. And I think if we all think about, everyone on this call now has got their own individual context, their own individual incomes, and how much is disposable of that income will differ between all of us. And I think we'd all do different things with it all. Imagine we all were receiving, I don't know, £500 a month, say. So for me to sit here and give you, I just can't give you a straight answer, as you can tell.
Yeah. And did you?
It's one of the complexities, really, isn't
it? Did you come across? Do you remember any literature looking at higher earners getting access to this in any of the studies? Do you remember?
Off the top of my head, Kim,
no.
to be honest.
No, that's fine. I guess when these are introduced, that's not what the focus tends to be, does it? So, yeah, really interesting that there's been no universal approach. Another question, and this from Nathan, is there any evidence of the effects of basic income or universal basic income on labour markets?
I can answer in some degree on that one. So, one of the criticisms is always, like I said in the presentation, really, that it will cause people to leave work or just quit work or just abandon work altogether. Actually, it doesn't happen. It's not borne out in the trials, and what you see is an increase in entrepreneurship, because people feel that they can take that brave step to start a business, knowing that if it's a bit wobbly in the first couple of months, that you've got that safety net coming in every month anyway. That certainly was borne out in Ontario's example. You also see people reduce, whether it's a negative, I don't think it's a negative. Some people have reduced their hours, and the income supplements the income they would receive working full time. Not a negative in my perspective. That gives people the time to do other things in life, the caring responsibilities we so value in the world. So I haven't seen any overwhelming negative effects. But again, it depends on your ideological perspective, doesn't it? Some people might see that reduction of working hours as a negative based on their ideological position in life. I don't. I'd use it to do some artistic endeavours, and I'd love it if it was me. But again, a lot. This is the other thing with all this, isn't it? The evidence is down to your interpretation of the evidence as well. But on the whole, labour market effects are negligible in either direction.
Thank you, Adam. And I think it's time to call this to an end. Unfortunately, I think the questions continue to come, and I think we could spend a lot longer discussing this, but I really appreciate your expertise, your input, and your insights and answers to these questions. I hope everyone has enjoyed these talks and answers. I certainly have. And could you please, whatever you thought of it, fill in your views and give us some feedback on the web SurveyMonkey link, which is in the chat bar at the moment. And if you're interested in us covering any other topics, please let us know through the Public Health Network Cymru email address or website. And if you're not a member, do of course sign up. Thank you again. Thank you particularly to Jacob from the Future Generations Office and Adam Jones from our World Health Organization Collaboration Centre, and wish you all a very good day. Goodbye.